Don't let money determine that. Determine if that was your mom or if that was your sister, would you do the case or would you refer it to someone who's more experienced? And if you say that you would do the case and you actually like your mom and you actually like your sister, do the case. But if you would say, you know what, I'm not good enough to do the case, I want to send her to the best, then you shouldn't be treating that patient. And until you get to that sense where you would treat your own family, not because it's free, but because you're going to do the best for your family, don't treat that patient. Be honest with yourself. Be passionate about what you do. And more importantly, have respect for your craft. And if you don't have that, it's not okay.
Final topic and is these remote Anchorage or these pterygoids, zygoma, where they're tacking them to the cheek.
Yes.
And things. Do you think that's being overdone?
Yes.
You do?
I think it's a great question. I think, I've been doing zygomas and remote Anchorage for over 5 years.
If a patient is listening to this, we're talking about longer implants that don't necessarily attach to the regular part of the bone. They're going into the cheek, is that right?
Yeah, they go into the cheek, and the bone in the cheek is spectacular, and they're very, very highly successful. But one of the things that we're seeing in the industry today is that dentists are flying to that solution way too quickly when they can do something for a patient that hurts less, that's done quicker, that is less invasive, that is less disruptive, and has less post-op complications. So before you go and you sign up for this remote Anchorage, which is very successful, make sure that all of your options are exhausted, that you have no other option but doing this.
Okay, now I don't know a thing about it other than, in my mind, logically, if you get a failure or a problem, it's like attached to your face.
That's right.
It seems like it's going to be amazing.
But they don't fail. That's the thing.
They're good.
They're really good. If they're done correctly, they're really,
Then how could they be overdone?